The compensation and pension examination, the infamous C&P exam, is the single most critical juncture in your journey toward securing the disability benefits you earned through service. And let's be brutally honest, the person sitting across from you, the examiner, holds the key to your financial future. It's the moment where years of sacrifice, struggle, and medical documentation are distilled down into a few check marks on a disability benefits questionnaire, or DBQ, and the fairness of that process often hinges entirely on where that examination takes place and who is administering it. If you walk into the wrong room, if you see the wrong provider, you risk months, even years, of appeals, denials, and unnecessary stress, all because the initial snapshot of your condition was flawed, rushed, or biased. We need to flip the script. Stop leaving this to chance and start treating the IKO C&P exam process like the tactical operation it is. We are going to dissect the minefield and map the safe zones. We are going to look at the 7 places, the 7 specific types of examination settings that statistically and anecdotally lead to the lowest ratings, the most egregious underestimations of your disability, and the highest denial rates. And then, immediately afterward, we will pivot to the 7 best places, the environments and provider profiles that are most likely to deliver a fair, accurate, and comprehensive assessment of your service-connected conditions. This isn't just theory. This is about understanding the logistical structure the VA uses to process millions of veterans and finding the seams where the system works for you instead of against you. Let's start with the danger zone, the 7 worst places to secure a fair VA disability examination. Knowing these pitfalls is your first line of defense. The absolute worst place to get a fair VA disability exam is the overworked, under-resourced local VA clinic, especially for non-primary care specialties. Now, this might sound counterintuitive because it's the VA, right? Shouldn't they be the most supportive? In theory, yes, but in reality, many local VA medical centers, particularly smaller community-based outpatient clinics, CBOCs, are drowning in clinical responsibilities. The staff physicians and nurse practitioners at these locations are primarily focused on treating existing patients, managing chronic illnesses, and handling urgent care needs. When a C&P request comes in, it's often dumped onto a provider who is already running 15 or 20 minutes behind schedule. They are performing the C&P exam not as their dedicated, focused job, but as an add-on duty. Think about the mindset difference. A dedicated contract examiner's sole focus is the DBQ and the evidence, but the VA clinician is thinking about the 3 patients waiting for medication refills, the emergency consult they just received, and the stack of charts they need to sign off on. This distraction inevitably leads to rushed exams. The specific danger here is the lack of specialized time and focus. If you are being seen for a complex orthopedic issue, say chronic knee instability, requiring specific range of motion measurements under 38 CFR requirements, the VA provider, who might be a general internal medicine specialist, may not have the dedicated time or the precise knowledge of the orthopedic DBQ nuances to perform the measurements correctly, or they might simply rely too heavily on the existing records without performing a thorough physical exam. They might miss subtle but critical findings, like crepitus or joint locking, simply because they are moving too fast. Furthermore, these local clinics often lack the specialized diagnostic equipment or ancillary staff needed for complex C&P assessments, forcing the examiner to rely purely on subjective reports, which, while important, are often insufficient to meet the strict evidentiary standards for higher ratings, especially when dealing with conditions requiring specific objective measurements. This scenario is particularly disastrous for conditions that require specialized observation, like neurological disorders or complex gastrointestinal issues, where the provider's generalist background and time constraints combine to create an environment ripe for an inadequate and thus unfair Assessment. The key takeaway here is that if your exam is scheduled at a local VA clinic, especially one known for high patient volumes and long wait times, you must be prepared to be extremely concise, focused, and insistent on ensuring every required measurement, as outlined in the DBQ for your specific condition, is performed accurately and recorded meticulously, understanding that the provider's attention is likely split among multiple competing clinical priorities. This lack of dedicated C&P focus is a systemic flaw that frequently undermines the fairness of the resulting examination report, leading directly to lower ratings or outright denials that necessitate lengthy and stressful appeals. Second on our list of the worst places is the brand new high-volume contract examiner working for a major third-party company. The VA utilizes large contractors, companies like VES, Optum, LHI, now part of Optum, to manage the sheer volume of C&P exams. While these contractors employ excellent providers, the high-volume model, particularly with newer examiners, presents significant risks. These providers are often incentivized by volume and speed. They are paid per exam, and the faster they complete the file, the more money they make. A new examiner, fresh to the C&P process, might be technically proficient in their medical field, but they often lack the crucial institutional knowledge of the VA rating schedule, the nuances of the DBQ, and the specific evidentiary requirements needed to sustain a high rating. The danger manifests in two primary ways. First, the lack of depth. A seasoned VA rater understands that the C&P exam is not just a medical appointment, it is a legal document. A new contract examiner, eager to move quickly, might spend only 10 or 15 minutes on a condition that demands 30 or 40. They might fail to adequately document the frequency, severity, and duration of symptoms, particularly the crucial impact on occupational and social functioning required for mental health ratings. Second, the new examiner is often overly reliant on the training provided by the contracting company, which sometimes emphasizes efficiency over comprehensive documentation. They might check a box indicating mild symptoms when the veteran's testimony clearly indicates moderate or severe, simply because they didn't probe deep enough into the veteran's daily struggles. They might incorrectly interpret the difference between pain on motion and painful motion, a distinction that can be the difference between a 10% and a 20% rating for an orthopedic condition. If you receive notice that your exam is with a provider who has minimal history or is part of a large assembly line style facility, your guard must be up. You need to be the one slowing the process down, gently guiding them back to your key, symptoms, and ensuring they record the full scope of your functional impairment. This high-volume, potentially inexperienced environment is a systemic risk factor for inadequate evidence gathering, which inevitably translates into an unfair rating decision. The pressure on these providers to maintain a high throughput often overrides the necessary meticulousness required for accurate veteran assessments, creating a scenario where speed compromises justice. Third, be wary of the specific specialty known for low ratings or conservative documentation, particularly certain independent psychologists or psychiatrists known for gatekeeping. Within the world of C&P exams, certain medical specialties, or even specific groups within those specialties, develop reputations. This is often seen in mental health examinations, especially for post-traumatic stress disorder, PTSD, or major depressive disorder. While most mental health examiners are dedicated professionals, there is a subset, often those who work exclusively for the VA system or certain contractors, who adopt an extremely conservative approach to rating. They may be highly skeptical of subjective reporting, or they may possess an unconscious bias that minimizes the severity of non-visible injuries. The consequence is a phenomenon known as underrating. A veteran might present with clear, documented evidence of occupational and social impairment. Yet the examiner's report focuses almost exclusively on the veteran's ability to maintain basic hygiene or interact minimally with the examiner, dismissing the chronic inability to hold a job or maintain relationships. They might downplay panic attacks, stating that the veteran appeared calm during the exam, failing to recognize that the veteran is masking or dissociating in a clinical setting. They might focus on the lack of current hospitalization, ignoring the chronic, debilitating nature of persistent anxiety. Furthermore, some examiners are notorious for misapplying the criteria for the 70% or 100% mental health ratings, confusing total occupational and social impairment with the mere presence of symptoms. They might fail to adequately document suicidal ideation or gross impairment in thought processes, simply because the veteran is articulate or high-functioning in short bursts. The danger here is that the examiner's report becomes a restrictive filter, minimizing the severity of symptoms even when the medical evidence and lay statements overwhelmingly point to higher impairment. If you hear whispers about a specific provider or clinic known for their tough mental health exams, prepare meticulously. Ensure your lay statements and supporting evidence are exceptionally strong, detailing specific examples of occupational failure and social withdrawal, making it impossible for the examiner to ignore the functional reality of your condition, thereby counteracting the inherent conservatism of the examining physician. The institutional culture of skepticism in these specific examination settings is a major barrier to securing a fair evaluation of non-visible yet profoundly debilitating mental health conditions. Fourth, you must avoid the provider who rushes the exam, the infamous 5-minute exam. This is less about the location and more about the specific behavior of the examiner, but it often correlates with high-volume contract facilities or overwhelmed VA clinics. The 5-minute exam is a clear violation of the spirit, if not the letter, of the C&P process. A complex condition, such as bilateral shoulder impairment or fibromyalgia, requires time for history-taking, time for physical manipulation, and time for detailed documentation. When an examiner attempts to condense this process into a negligible time frame, they are fundamentally failing to develop the evidence necessary for a fair rating. What happens in a 5-minute exam? Critical elements are skipped. For an orthopedic issue, the required range of motion measurements are often estimated or simply omitted, replaced by a cursory visual inspection. The examiner might ask, "Does your back hurt?" And upon receiving an affirmative, simply check a box without performing the required measurements of forward flexion, lateral flexion, and rotation, all of which are mandatory under the VA schedule for rating disabilities. For tinnitus, they might simply ask if you hear ringing, failing to inquire about the severity, constancy, and impact on sleep and concentration, which are crucial factors in the rating criteria. For chronic pain, they might fail to document the necessary frequency of flare-ups or the need for continuous medication, thus minimizing the overall functional impairment. The result is a DBQ that is technically complete, but substantively empty, lacking the crucial data points that support a higher rating. If an examiner attempts to rush you, you must politely but firmly insist on a thorough examination. You have the right to ensure the DBQ is completed accurately and completely, and if the provider is unwilling to spend the requisite time, this signals a systemic failure that you must document immediately and report. The 5-minute exam is a clear red flag that the resulting report will be inadequate, leading to a presumptive denial or a significantly reduced rating based on insufficient evidence. This speed-driven approach fundamentally compromises the integrity of the evaluation process, making the resulting decision inherently unfair. Fifth, be extremely cautious of telehealth for complex physical conditions requiring physical assessment. The COVID-19 pandemic accelerated the use of telehealth for C&P exams, which is excellent for certain mental health evaluations or follow-ups where observation and history are paramount. However, telehealth is a potential disaster when applied to conditions that rely heavily on objective physical measurements and hands-on assessment. Consider a condition like peripheral neuropathy, where the examiner needs to test reflexes, sensory responses, muscle strength, and gait. These elements are impossible to assess accurately over a video call. The examiner is forced to rely entirely on the veteran's self-reporting and whatever visual cues they can gather, which introduces massive potential for error and underestimation. The core issue is the impossibility of satisfying the DBQ requirements remotely for physical conditions. For example, if you are claiming disability for residuals of a traumatic brain injury, TBI, affecting coordination and fine motor skills, the examiner needs to perform specific tests, like the Romberg test or detailed manual dexterity assessments. A telehealth examiner cannot accurately measure the severity of a tremor or the true range of motion of a painful joint. If the resulting DBQ is incomplete because the necessary physical measurements could not be taken, the VA rater is left with insufficient evidence to grant a high rating, forcing them to rely on older, potentially outdated medical records or to simply defer the rating until an in-person exam can be scheduled, causing significant delay. If you are scheduled for a telehealth exam for an orthopedic, neurological, or complex internal medicine condition, you should immediately request an in-person appointment, explaining clearly that the nature of your condition necessitates objective, hands-on physical assessment to comply with the requirements of the VA schedule for rating disabilities. Accepting a telehealth exam for a condition requiring physical measurement is akin to forfeiting your ability to present objective evidence, severely limiting your rating potential and making the process inherently unfair. The convenience of remote examination does not outweigh the necessity of accurate physical data when determining the degree of functional impairment. Sixth on the list of pitfalls is the provider with a history of negative reviews or known bias, the known gatekeeper. Just as certain clinics develop reputations, specific individual examiners become known within the veteran community, often through word of mouth or online forums, for being particularly difficult, overly critical, or biased against veterans seeking disability compensation. These are the gatekeepers, providers who seem to approach every exam with an inherent skepticism, viewing the veteran as potentially exaggerating or malingering rather than suffering from genuine service-connected conditions. The danger here is the deliberate, often subtle, distortion of the facts. A gatekeeper might document subjective complaints accurately, but then minimize the objective findings, or they might selectively focus on positive aspects of the veteran's life, e.g., the veteran drives a car, or the veteran occasionally leaves the house, while ignoring the chronic, debilitating pain or mental health crises that dominate the veteran's life. They may use loaded language in PISTA, their narrative summary, employing terms like self-serving or inconsistent effort when documenting a range of motion tests, even if the veteran is genuinely limited by pain. This narrative framing, often based on the examiner's personal bias rather than objective medical fact, can be devastating to a claim. VA raters are trained to look for inconsistencies and red flags, and a negative narrative from an examiner, especially one known within the system for their conservative approach, can heavily influence the final rating decision, often leading to a denial, even when substantial medical evidence exists elsewhere in the file. Before any exam, especially with a contract provider, a quick discreet search for the provider's name and reviews can be invaluable. If you find consistent negative reports indicating bias or unfair documentation, you should attempt to reschedule or request a different examiner, citing concern over potential bias impacting the fairness of the evaluation. Walking into an exam with a known gatekeeper is starting the race 100 yards behind the starting line, making a fair outcome exceptionally difficult to achieve. The impact of examiner bias, even if unconscious, can fundamentally undermine the objectivity required for an accurate disability determination. Finally, the seventh worst scenario is the examiner who focuses solely on the current file, ignoring crucial lay evidence and the veteran's full history, the paper pusher. The C&P exam is supposed to be a comprehensive review that integrates the veteran's service medical records, private medical documentation, the veteran's own lay statements, buddy statements, and the physical mental findings of the exam itself. A poor examiner, the paper pusher, treats the exam like a purely administrative task, limiting their review only to the most recent medical notes provided by the VA and completely disregarding the critical context provided by lay evidence. Lay evidence, the veteran's own testimony, and the statements of friends and family, is often the most vital component of a successful claim, especially for conditions that wax and wane, or for mental health conditions where internal struggles are not always visible in clinical records. For example, a veteran might have excellent medical records detailing their knee injury, but the lay statement explains that the pain flares up so severely after 30 minutes of standing that they cannot hold any job requiring standing, which is essential for determining occupational impairment. If the examiner ignores this lay evidence, their report will be incomplete. They might state, range of motion is limited, but functional. Impairment is mild because they failed to read the buddy statement detailing the veteran's inability to participate in family activities due to pain and fatigue. Furthermore, this type of examiner often fails to adequately address the nexus, the link between the current disability and military service, because they are unwilling to look beyond the immediate medical file to the original injury reports or in-service events documented years ago. If you encounter an examiner who seems uninterested in your narrative or dismissive of the statements you provided, you must gently but firmly redirect them to the relevant documents, stating clearly, I submitted a detailed statement on the functional impact of this condition. I need to ensure that is considered in your assessment. Allowing the examiner to operate solely within the confines of a limited medical file severely restricts the potential rating and ensures the resulting decision will be based on an incomplete picture of your disability. This narrow focus compromises the comprehensive nature intended for the C&P process, leading to a decision based on administrative convenience rather than evidentiary totality. Now that we have navigated the minefield and identified the 7 worst places and scenarios for a fair C&P exam, let's pivot and focus on the environments and providers who are most likely to deliver the accurate, comprehensive, and fair assessment you deserve. These are the safe zones, the tactical advantages you should seek out whenever possible. The first best place to get a fair VA disability exam is with specialized private practice contractors, particularly those who focus on niche, complex conditions. Not all contract examiners are created equal. While the high-volume firms have their pitfalls, there are many smaller specialized practices contracted by the VA to handle complex or unique cases. These providers often run their own established private practices and perform C&P exams as a secondary, highly focused source of income. Because they are not solely reliant on the volume-driven model, they tend to be less rushed and more meticulous. The advantage here is depth of expertise and time. If you have a highly specialized condition, say residuals of a rare infectious disease contracted overseas, or a complex gynecological issue related to service, seeing a specialist who deals with that condition daily is invaluable. They understand the subtle presentation of the disorder. They know exactly which tests and measurements are required by the DBQ, and they are less likely to misinterpret symptoms. Furthermore, these specialists often operate in quieter, less chaotic environments than the high-volume contractor mills or the busy VA clinics. This allows for a more relaxed, thorough interaction where the veteran feels heard and the examiner has the necessary mental space to document complex findings accurately. When you receive your exam notification, research the provider's primary practice. If they run a successful, well-regarded private practice in the field related to your claim, this is generally a strong positive indicator that the exam will be comprehensive and fair, as their professional reputation is tied to the quality of their clinical work, not just the volume of C&P reports they churn out. The meticulousness inherent in specialized private practice often translates directly into higher quality DBQ documentation, which is the bedrock of a fair rating decision. Second, look for the anomaly. The specific regional office, RO, or VAMC known for fairness and efficiency in scheduling. While the C&P exam is usually performed by a third party or local VA staff, the scheduling and oversight process is managed by the regional office. Some regional offices or specific local VA medical centers, VAMCs, have established highly efficient, veteran-centric systems for managing C&P exams. These are often VAMCs in lower population areas or those that have dedicated, well-trained C&P staff who prioritize quality over pure speed. The benefit here is administrative competence. In these well-run locations, exams are often scheduled with providers who have a proven track record of accurate and timely reporting. The administrative staff ensures that the veteran's entire file, including all lay evidence, is correctly transmitted to the examiner before the appointment. This prevents the paper pusher scenario described earlier. Furthermore, these locations tend to have better internal quality control, meaning if an examiner submits a clearly inadequate or incomplete DBQ, the local C&P coordinator is more likely to flag it and request clarification or a supplementary exam, rather than simply letting a flawed report proceed to the rating specialist. While you cannot choose your regional office, you can observe the efficiency and communication of the scheduling staff. If the process feels organized, if communication is clear, and if the provider is well prepared upon your arrival, you are likely operating within a well-managed system that is conducive to a fair outcome. Administrative efficiency and proactive quality control are silent but powerful allies in the pursuit of an accurate disability determination. Third, always prioritize in-person exams for complex physical conditions, especially those requiring specific range of motion measurements or hands-on neurological assessment. This is the direct counterpoint to the telehealth pitfall. For any condition where the rating schedule demands objective physical findings, be it limitations due to pain, joint instability, or neurological deficits, an in-person examination is non-negotiable for securing a fair rating. The advantage of the in-person setting is the ability to generate objective, measurable data that directly correlates with the VA rating criteria. The examiner can use a goniometer to measure joint movement precisely. They can perform necessary stability tests, and they can observe gait and posture in a controlled environment. Crucially, they can perform the required stress tests and observe painful motion. Under VA regulations, painful motion is often rated at the minimum compensable level, usually 10% for a joint, even if the range of motion is otherwise normal. This critical observation is impossible to document accurately via telehealth. Furthermore, the physical presence allows the examiner to observe the veteran's nonverbal cues related to pain, fatigue, and functional limitation, adding depth to the narrative summary that a rater can rely upon. If your condition is physical and requires measurement, insist on an in-person exam. If you are offered a remote option, politely decline and request a physical location, explaining that accurate assessment of your specific condition, e.g., limitation of motion, muscle weakness, gait disturbance, requires hands-on evaluation to ensure compliance with the criteria set forth in 38 CFR. Prioritizing the in-person exam ensures that the evidentiary record contains the objective data points necessary to support a maximized and accurate rating decision. Fourth, seek out the long-term established VA staff physician who is performing C&P exams as a dedicated part of their workload. These are often the unsung heroes of the C&P system. Unlike the overwhelmed generalists at local clinics or the high-volume contract newcomers, some VAMCs employ physicians, nurse practitioners, or physician assistants whose primary, or at least a significant, component of their job is performing C&P exams. They are established within the VA system and possess deep institutional knowledge. The benefit lies in their understanding of the rater's perspective. A long-term VA examiner has likely seen hundreds, if not thousands, of DBQs returned for clarification or correction. They know exactly what language to use, what measurements must be included, and how to structure the narrative to clearly establish the nexus and the severity of functional impairment according to the VA's specific, often arcane criteria. They understand that the difference between the veteran reports difficulty sleeping and the veteran reports chronic insomnia, resulting in frequent daytime fatigue and inability to concentrate, directly impacting occupational function, is the difference between a low rating and a high rating. They are less likely to be swayed by external volume pressures and more likely to prioritize the completeness and accuracy of the report as it reflects directly on their performance within the VA system. If your exam is scheduled at a VAMC and you find the provider has dedicated C&P time slots, this is generally a positive sign that you are dealing with a professional who understands the unique requirements of this specialized medical legal process. Their institutional experience provides a crucial layer of competence that often results in highly persuasive and fair examination reports. Fifth, the ideal scenario involves the examiner who requests clarification or further testing, the thorough investigator. This is less about location and more about the examiner's methodology, but it is the gold standard of fairness. A truly thorough examiner understands that their job is not just to check boxes, but to ensure the VA has a complete and unambiguous picture of the veteran's condition. If, during your exam, the provider states something like, "Based on your report, I think we need to order an updated MRI to confirm the extent of the degenerative changes," or "Your file is missing a key piece of documentation regarding the in-service event. I will request a temporary pause to ensure that evidence is gathered. You should see this as a massive win, even if it delays the process slightly." This examiner is taking ownership of the evidentiary development. They are not satisfied with a weak or incomplete record. They are actively working to build a robust case supported by current objective medical data. This contrasts sharply with the paper pusher who simply documents what they see and moves on. A thorough investigator will produce a DBQ that is nearly bulletproof because it preemptively addresses potential deficiencies in the medical evidence, making it much harder for a VA rater to deny or lowball the claim due to insufficient objective evidence. While this thoroughness might extend the timeline, the resulting fairness and accuracy of the final report are invaluable. Sixth, prioritize. The provider who specializes in military and veteran health, cultural competency. This is particularly crucial for mental health, TBI, and chronic pain claims. Cultural competency means the examiner understands the unique stressors, environments, and cultural norms of military service and how these factors influence symptom presentation and reporting. An examiner who specializes in veteran health understands concepts like military stoicism, the reluctance to report mental health struggles, and the unique language used in military environments. They are less likely to misinterpret a veteran's reserved demeanor as a lack of symptoms or minimize a severe injury because the veteran is trying to suck it up. They know how to ask probing questions about deployment, combat exposure, and military sexual trauma (MST) in a way that builds trust and elicits accurate information, rather than shutting the veteran down. For a PTSD claim, a culturally competent examiner will recognize the signs of dissociation, hypervigilance, and avoidance behaviors, even if the veteran attempts to mask them. They understand that a veteran who reports being fine might actually be functionally impaired but unwilling to admit weakness. This understanding translates directly into a more accurate and compassionate documentation of symptoms, leading to a fairer rating decision that reflects the true severity of the service-connected condition. Seeking out providers with specific certifications or stated experience in military health dramatically increases the likelihood of a fair and understanding evaluation. Finally, the seventh best scenario is securing an exam at a PTAB medical center, VAMC, in a low-volume rural area. While we cautioned against the overworked local VA clinic, the VAMC in a low-volume area often operates under vastly different conditions. These facilities typically have lower administrative pressure, fewer urgent care demands, and generally longer appointment slots allocated for C&P exams. The advantage is reduced stress and increased dedicated time. In a low-volume VAMC, the providers performing C&P exams are often able to dedicate the full scheduled hour or more to the assessment, ensuring all measurements are taken, the history is comprehensive, and the narrative summary is detailed. They are less likely to be interrupted by competing clinical demands and more likely to view the C&P as a focused task rather than a burdensome add-on. Furthermore, the environment is often calmer, which is beneficial for veterans dealing with anxiety, hypervigilance, or chronic pain. A relaxed environment promotes better communication and allows the veteran to present their symptoms clearly and accurately without the added stress of a chaotic, high-traffic setting. While traveling might be necessary, securing an exam in a lower-volume setting often pays dividends in the form of a thorough, unhurried, and ultimately fair examination report. The C&P examination is not merely a bureaucratic hurdle. It is the central pillar upon which your disability claim rests. Understanding the systemic weaknesses of the process, the dangers posed by high-volume contractors, the risks of inexperienced examiners, the limitations of telehealth for physical conditions, and the pitfalls of biased gatekeepers allows you to anticipate and mitigate these risks. Conversely, actively seeking out the best environments, the specialized experts, the thorough investigators, the culturally competent providers, and the well-managed administrative settings provides you with a crucial tactical advantage. Your goal is not just to attend the exam. Your goal is to ensure the examiner has every piece of necessary evidence presented in a clear, concise, and compelling manner, enabling them to produce a DBQ that is so complete and accurate that the VA rater has no choice but to grant the highest possible rating commensurate with your functional impairment. By treating the C&P process with the tactical seriousness it deserves, you shift the odds dramatically in your favor, moving away from the uncertainty of denial and toward the security of deserved compensation. Remember these 14 points, prepare meticulously, and walk into that exam room ready to advocate for the fairness you are owed.